Ventricular tachycardia. VT. 1. Pathophysiology. Ventricular tachycardia (VT) is a fast, abnormal heart rhythm that originates from the ventricles, the lower chambers of the heart. It is defined as a heart rate of over 100 beats per minute with at least 3 consecutive irregular ventricular beats. VT is potentially life-threatening, as it can deteriorate into ventricular fibrillation (VF) and cause sudden cardiac arrest. 2. Onset and duration. 3. Prevalence. 4. Signs and symptoms. Symptoms vary depending on the rate of the arrhythmia and whether it affects the heart's ability to pump blood. Faster rates, especially in sustained VT, may result in decreased cardiac output and hemodynamic instability. Common symptoms include palpitations, dizziness or lightheadedness, syncope, shortness of breath, chest pain, fatigue, cardiac arrest. 5. Complications. Sudden cardiac death, heart failure, thromboembolism, myocardial ischemia. 6. Causes and risk factors. VT typically results from a structural or electrical abnormality in the heart. Common causes and risk factors include myocardial infarction, heart attack, heart failure, cardiomyopathies, electrolyte imbalances, inherited arrhythmias, drug toxicity, congenital heart defect. 7. Tests and diagnosis. Electrocardiogram (ECG), Holter monitoring, echocardiogram, electrophysiology (EP study), cardiac MRI, coronary angiography. 8. Treatment and medications. The treatment of VT depends on the patient's hemodynamic status and the cause of the arrhythmia. About acute management. Stable VT, P. Antiarrhythmic drugs. Cardioversion. Unstable VT. Pulseless VT. About long-term management. Implantable cardioverter defibrillator ICD. Antiarrhythmic medications. Catheter ablation. Treatment of underlying conditions. 9. Nursing points. Monitor for VT, B. Emergency response. Post-ICD care. Medication education. Address psychological impact. Monitor electrolytes.